Hi, Mark Agresti here. I have a new camera now, new microphone, new lights. Hopefully the quality's better. I've gotten a lot of complaints. Anyway, this video is on Adderall. How does Adderall work? Adderall is an amphetamine. Common names for it are speed, dextroamphetamine. It's a mixture of different salts. How does this drug work? Basically, it affects norepinephrine, serotonin, and dopamine. There are other drugs like cocaine that work on similar neurotransmitters, but that drug, cocaine, is much more euphorogenic, meaning it causes more of a euphoria. Adderall does not. I did a little diagram here, how this Adderall works. It basically allows you to use more of your own neurotransmitter. It doesn't create more. It simply allows what you have to work better. It sends an electrical signal down the neuron to the end of the neuron, and it comes here and releases it into what this would be called the synaptic cleft. And these would be postsynaptic vesicle receptors, where these neurotransmitters affect the other neurons. So it allows for your neurotransmitters to engage the receptors and cause electrical signals. Now, what is it used for? It's used for attention deficit disorder. It helps you focus. It's used for hyperactivity. It makes people calm. And usually the theory being that people with attention deficit disorder are low dopamine states, and we get them and we stimulate the dopamine receptors by releasing these neurotransmitters into that synaptic cleft where they can act on that postsynaptic receptor. It helps people stay calm, focus. It also can lift people's mood and help depression. It also helps people stay awake. So people who suddenly enter into sleep states during the day, like in narcolepsy, it can be used for treatments of narcolepsy. It also can help people study, helps decrease appetite. Major contraindications of this drug are should you have tics or heart problems, because it can raise blood pressure, it can affect arrhythmias. So someone with a congenital heart abnormality, you shouldn't give Adderall. I wouldn't give it to someone with a tic or a tremor. It makes it worse. Those are the basic contraindications. What are the side effects of Adderall? I've been using this drug. It's very old. Amphetamines, I've been using that class of drugs for 30 years. Big ones are headache, tremor, dry mouth, problems sleeping, keeps you awake, irritability. You can get paranoid if you use too much. Makes you impulsive. It can stop your inhibitions. It can cause anxiety and stomach aches, and if kids don't eat, they don't grow. It can cause growth problems. I've seen some people complain of cold feet, numbness. Of course, the major ones are increased heart rate, increased blood pressure. When it wears off, it can make you irritable, make you angry. It can make people hyper-focused and just sit there and stare. It can cause digestive problems because abdominal pains, diarrhea. It causes vasoconstriction of your vessels, and excessive use can affect kidneys and your heart. They don't get perfused with enough blood. So here we have the good of Adderall. So why, when you hear about it in the media, are people always kind of saying, oh, Adderall's bad? Well, Adderall can be abused. People who abuse Adderall can smoke it or snort it. You can get high if you use too much. The average dose is between 20 and 40 milligrams a day. People who abuse it can up to 500 milligrams a day, 1,000 milligrams a day. At that dose, you can become paranoid, can shut your thoughts down, you can become disorganized, inappropriate. It can lead to overdose. It's extremely rare. It's very hard to overdose on Adderall. It's a pretty safe drug. But you can get a heart attack, a stroke, shut your kidneys down. You can overdose and die from Adderall. It's exceedingly rare. Where opiates like fentanyl, oxycodone, hydroxycodone is extremely easy. Not so with Adderall. But one thing with Adderall, tolerance. You take a little bit of the drug every day. After about a week, you need more and more of the drug because your body becomes very tolerant to it. Now, I've had people, as I said, smoke it or snort it, but also use it with cocaine, marijuana, or alcohol. Well, if you use it with cocaine, it can enhance the effects. If you use it with marijuana, the marijuana minimizes some of the anxiety associated with Adderall, so the two go together. If you drink on it, you can drink much more because you don't fall asleep from the alcohol, so you get really severe alcohol poisoning. I've seen it all. College students use it to help them study for exams. I think Adderall right now is the most prescribed amphetamine out there. What's the general gist? Adderall is a pretty safe drug. It's effective. It helps attention deficit disorder. It helps narcolepsy, can decrease appetite, improve your mood, help with learning. Can it be abused? Yes. Is it dangerous in overdose? Extremely low. You never hear about Adderall overdoses because it's extremely rare, but it can happen. Overall, is this a good drug? If it's used within prescribed amounts, it is a great drug. But it has potential for abuse if not used correctly. And that's why I think it always needs to be regulated by prescription, and people can't take more than they're supposed to. And they can only get so much a month, and that's it. That's the general overview of Adderall. By and large, good drug. I think its use is appropriate. Long-term damage from Adderall is minimal. If used correctly, virtually none. So I recommend its use, and I think it's a good drug. Thank you. Dr. Mark Agresti.